And we are hearing a lot of people with, severe conditions from COVID and also the flu, which we certainly have seen over many years. In terms of when you're infectious with the flu, how soon are you?
Yeah, it's important that people realise that in the day before you become symptomatic with a runny nose and a cough, you're already you're already infectious and you're already spreading the virus. So, you can prevent some infection by isolating once you're sick, but the key thing is not to be doing presenteeism, going to work, soldiering on, but absenteeism and working from home. The other key thing is that if people do get sick and they know they're not a well person already, book into the GP early and get a test, and you can be tested at the same time for both flu and COVID, as I was by my excellent GP this week. And if you've got one or the other, you can get an antiviral from your GP, which is specifically effective against flu or specifically for COVID. So there's a number of things that you can do. It's impossible to prevent transmission of flu or COVID, but you can reduce it by the measures I've mentioned already.
And what about some other illnesses that we're seeing through the country?
Yes, we've seen a bit more whooping cough, and that's on the rise. And the thing about influenza, which is rising right now, is it stirs up the lining of the throat and allows bacteria, which are sitting there quietly, to invade. And there's several really severe bacterial diseases that are on the surge. Group A streptococcus, pneumococcus, which causes pneumonia, meningococcus, which causes blood poisoning, and meningitis. So these things are, with the winter, increasing again. And so if you can avoid flu, you might also avoid secondary bacterial infection as well.
And talk us through the immune system. If you perhaps just coming off a bout of the flu, does that increase your immune system? What are the things that we hear that are perhaps true and not true?
Well, viral infections generally suppress your immune system. They work against your T cells and your antibodies, so you're actually at risk of what I've described already: secondary, subsequent bacterial infections, with a number of viral infections like EBV, glandular fever, it can suppress your immune system so that you get chronic fatigue. That's most common with EBV. It can occur with other viruses like CMV and sometimes with flu. And of course, you can get long COVID, where symptoms of fatigue and brain fog and muscle ache can last for 3 months or more after COVID. The viruses get you in the short term, but they can also, to a lesser extent, cause damage in the longer term.
And I guess, looking at perhaps someone just having a common cold as opposed to the flu, what are the different symptoms there?
Yeah. Well, to start with, they both look the same. They're both feeling a bit off colour, a cough, maybe a headache, a runny nose, a fever. But it tends to be that flu is more severe. It can knock you out, so you really don't want to get out of bed. And so you tend to have more severe symptoms with the flu, but a lot of them overlap with the common cold. So if you're getting progressively severe symptoms, that's when it's a good idea to check in with your GP as to what might be the cause and what might be the best treatment.
And some people have their own sort of home remedies. What are you doing for yourself, Professor, to stay well, besides the antivirals, of course?
Yeah, well, rest and hydration. And my GP gave me an antibiotic, which I stopped once it was confirmed it was flu, because I didn't need it. So there are antivirals for the virus and there are antibiotics for bacteria. So they're different things. And sometimes you're more likely to be prescribed an antibiotic when you actually need an antiviral.